Food addiction. How common is it, anyway? Coming up now on Toronto Speaks Addiction. Hi, I'm Dr. Vera Tarman, and welcome to Toronto Speaks Addiction. Tonight, we're discussing how food can be an addiction. Are you a food addict? Do you know someone who might be? Joining me is Martha Peirce, a pioneer in the field of food addiction treatment. Martha has worked with food addicts in the GTA for over 25 years. Now, this area is of special interest to me. I have written the book, Food Junkies, The Truth About Food Addiction, and I'm overseeing Renaissance New Food Addiction Pilot, which opens its doors this month. We're here to answer your questions about food addiction and how it can destroy your life just like alcohol or cocaine. And we're also discussing the most effective treatment. So whether you're the food addict or you know someone who is, please give us a call. Martha, welcome to Toronto Speaks Addiction.
Thank you.
Really pleased that you're our guest for tonight. Can you please give the audience, give me your definition of what food addiction is?
Food addiction, in my way of looking at it, is the inability to absolutely control your intake of certain kinds of foods, particularly sugary, salty, fatty, floury substances. And at times, or initially, there may be periods of time of feeling like I can control the intake of these certain kinds of foods. And then sooner or later, there is the inability to control the consumption of these food items, not unlike what it's like for an alcoholic.
Okay. Well, let me ask you a question. A lot of people say that they have a problem with, like, if they're eating too much ice cream or something, and they try to cut down. Would you say that they're food addicts?
Not necessarily.
Okay. So what's the difference?
The difference is that, if someone thinks they're eating, for example, too much ice cream, and they make a conscious decision to cut back on the consumption of that ice cream, and they're able to do it, then the behavioral change is working. They're able to healthily control.
Okay, but what about the people who keep not being able to stop?
Then they may be a food addict.
Okay.
They may be the kind of person that a teaspoon of that ice cream is too much and a roomful is not enough.
Well, what about the idea that in our food environment, the kinds of foods that we're exposed to today, I don't know very many people who can only have just one or two chips or one or two cookies. They usually want more than that. But would you call them food addicts?
Not necessarily.
Okay.
Again, a food addict is someone that in time, the consumption of these cookies or ice cream or potato chips controls their life. They may be the kind of person that, I'll just have part of a bag of chips, and 2 bags later, they're still eating the chips.
Right. Well, you said a couple things in the last little bit there. You were talking about that it's like alcohol or alcoholism.
That's right.
And then I heard you saying just a second ago about how it can control your life.
That's right.
Can you elaborate more on what that means?
Well, just like with in the disease of alcoholism, a person doesn't seem to be able to metabolize alcohol like a normal drinker might, and eat and drink in moderation. For the food addict, it's a similar sort of thing. They don't seem to be able to metabolize these food substances like a normal eater.
Right.
And there actually are physiological cravings. Long after a person has this sense of fullness, there is the craving for more and more and more.
So you're actually talking about a physiological thing, that it's not just a psychological
That's right.
thing.
It's physiological and psychological.
Okay. So, there's many of us who are prone to overeating or even maybe binge eating. And but are not necessarily food addicts, right?
That's right.
Yeah, so can you elaborate a little bit more on that?
In which case, in terms of someone that's an overeater, a person that is an overeater, perhaps they are overeating for emotional reasons.
Right, like comfort eating.
Comfort eating,
Yes.
Celebration eating, that sort of thing.
Right.
But for a food addict, it may be psychological, the reasons for picking up the food substances.
Yeah.
The reason for picking them up may be a psychological issue. However, sooner or later, something happens physiologically in the brain, as your book so aptly describes, and the person really loses the ability to control and make healthy decisions about the food intake.
Okay. Yeah, so you're saying that it's an actual physiological difference. We actually have a caller. So, Martha, I'm going to pick up on that a bit more, but let's take our caller. Sandra, hello. Welcome to Toronto Speaks Addiction. What is your question?
Hi, I definitely eat for comfort, and I
yes.
don't do it during the day, but I do it at night, like late at night, at about maybe starting at 10:30, 11, and I'll keep eating, and then, especially because everyone's gone to bed, so it feels like a free-for-all, and then sometimes I'll even be sick to my stomach because I ate so much, and I'll find myself still going to eat a piece of bread again after that before I go to bed.
So,
is that common?
Okay, well, Martha, I'll throw it to you. Do you feel that that's a common phenomena?
Well, certainly that doesn't surprise me in the least. A lot of times for folks, whether they're a food addict or they are using food for soothing or comfort, oftentimes the time of the day when it happens is late at night. It can be a way to soothe. It can be a way to cope with this is finally my time. Nobody's going to bother me. You know, if the food if you continue to eat the food beyond the sense of fullness, and you're you know, feeling ill as a result of it. It may be that there is an actual physiological component for you.
Yeah. So what Sandra's describing would be one way to deal with her emotions, or you know, difficulty at night, maybe at the end of the day. But you're suggesting that, well, if Sandra was a food addict, that there's actually something more going on, a physiological process.
That's right.
Yeah. Sandra, I take it that you're using this as a way of coping.
Actually, I think you hit it right on. It's definitely a way of coping, and at the end of the day, it feels like definitely my time. And I think that's exactly what I'm doing, because I have 2 children, and a stay-at-home mom, and I think you've got it.
Yeah. Oh, Sandra, thank you so much for your question. I mean, you've really highlighted a nice difference between, well, I mean, this is, I think, a fairly common phenomenon that people use this.
Yes.
Yeah.
You're not alone, Sandra.
Yeah. But it doesn't necessarily mean she's a food addict, right?
No.
It could be, but not necessarily.
That's right.
Yeah. Okay.
That's right.
All right. So what would you suggest, given if Sandra came to you as a client, what would you suggest that she do to cope instead, or find a different way of coping?
Well, you know, a great... okay.
Well, okay. Hold that thought. We have a break coming up, so hold that thought. We'll be right back after the break with more help on Toronto Speaks Addiction. Welcome back to Toronto Speaks Addiction. I'm Dr. Vera Tarman, and joining me is Martha Peirce. Today, we're discussing food addiction and the best way to treat it. So, Martha, what would you suggest that Sandra do in terms of alternative ways of coping?
Right. And so,
especially at night.
Right. And so what I heard Sandra say was that she was an at-home mom and she had children. It was the end of the day.
Yeah.
And perhaps she was using food to comfort herself.
Yeah.
And perhaps reward herself and calm down. From, I can only imagine what a hectic day she's had.
Yeah.
So alternatives might be to listen to some quiet music, to maybe do some meditation, to do some yoga, to watch a TV show that isn't too exciting but perhaps humorous.
Yeah, you know, one of the things that I've often suggested to people when they want to quit smoking, and I've realized that what they're really trying to do is get 5 minutes away from whatever it is that they're doing, outside, 5 minutes where they can go and have their smoke. And what I heard Sandra saying is that this was her time.
Right.
Carved out time that she used. So maybe if she could just say, I am going to carve out, just like the smoker, 5 minutes every hour to just go out and meditate, or something like that, and actually give herself that permission.
Right, a mommy's time out.
Exactly.
A mommy's time out that doesn't necessarily include food.
Exactly, that's right. Yeah. And to actually see that as a valid thing as opposed to, you know.
Right.
You know,
what I've actually seen some moms do is color with their children.
Oh, wow.
Coloring can be a very soothing activity.
Yeah.
And doing an activity that is quieting for the children can also be quieting for mom.
Yes. Okay, good. Well, let's get back to some food addiction stuff.
Okay.
So we were talking earlier about the sort of difference between overeating and food addiction, and so you're talking about a physiological thing. For our viewers, can you give some, like what would be some signs that would cue you that this is more than just overeating, this is something else?
Right.
Like some questions that you would ask them.
Well, some questions that I might ask a person is, how frequently do you find yourself overeating foods that may be addictive? You know, how much of your day in terms of your food consumption includes healthy food versus your binge foods? How much money are you spending on binge food? Are you sharing the binge food with other people, or is the binge happening in isolation? Does anyone know about your relationship with these foods? Is there a correlation between the kinds of foods you're eating and your health? You know, are there challenges with high blood pressure, migraine headaches, pre-diabetic,
or even diabetic.
Yeah. Yes.
Yeah. So when we talk about using the terminology addiction, I mean, we have a sort of set of criteria that we use for, you know, if somebody's addicted. And one of the, I guess the central theme that of all those questions, which are, you know, the substance abuse questionnaires, is about, like you mentioned earlier, the obsessional piece.
Right.
That the person, just like you in fact said, food, everything revolves around their eating.
Right.
Yeah.
Right.
I think the term is people don't eat to live. Wait a second.
They don't eat to live, they live to eat.
Yes, exactly.
And a teaspoonful's too much and a roomful's not enough.
That's right.
A pioneer in the field of recovery from eating disorders, just on the cusp of identifying food addiction, a woman by the name of Judy Hollis back in, I believe, the 1970s said, if you can take it or leave it, if you can hold the item loosely in your hand, if you can walk away from it and not think about it until the next time it's time to you know, satisfy healthy hunger, then you can have it.
Right, I see. Yeah, and if I think about the context of drinking and alcoholism, you know, at a certain point, a person, like a social drinker, will still get drunk if they have a couple of drinks, but at a certain point they'll say, I am too drunk and I'm going to stop, and
Right.
then they move on with their life.
Right,
Yeah.
and you made a very important point. You know, someone that has a healthy relationship with alcohol or a healthy relationship with food can make a conscious decision to stop because they
Right.
don't like the way they're feeling.
Exactly.
Food addict doesn't stop.
Right. Even if they're
No
bloated
matter how
and
much,
full, or
right, and to the point where they may be physically ill.
Yeah, and my experience is that people can, like even when they're so full that they can't eat anymore, it's not like they stop thinking about food.
That's
they're
right.
thinking about their next meal and when
That's-
they're hungry again.
that's right.
Wishing they could
That's
be hungry.
right. Or, you know, passing out because they're so stoned on sugar, perhaps, and then waking up in the middle of the night and going out and buying more food.
Yeah, yeah.
Or raiding, you know, the cupboards if they happen to have food.
I just want to open our conversation up to the audience. If there's anybody out there who's wondering if they're a food addict or they're troubled about their relationship with food, please give us a call. Martha's here to answer questions, and I'm here as well. So yeah, pick up the phone and give us a call. Anyway, Martha, so what would you? Well, actually. I want to ask about what would you do with somebody who thinks that they might be a food addict?
Well,
that they've got this unhealthy relationship to
right.
food.
Well, I think the first thing that I would do is, if they've reached out to me, is let them know how courageous I think they are for, you know, speaking up. And,
because there's a lot of shame in this area, isn't there?
There's a lot of shame, and there's a tremendous amount of isolation about food addiction.
Yes.
You know, I don't know too many food addicts that let people know that I'm going to binge tonight.
Right.
It can be very secretive and a very isolated behavior.
Yeah, I mean, it might even be a reason why a caller might not want to call.
That's right.
Yeah. That's actually
right.
a really good point, isn't
That-
it? Yeah,
that's
there's
right.
a lot of shame around this
That's
area.
right. So the
Yeah.
first thing I do is validate how much courage it's taken for them to reach out to me and to let them know that they're not alone and that they're not a bad person. And if they could control this, they would. And in fact, in food addiction, I see folks making a tremendous effort to try to control the addictive, what I view as addictive behaviors, when in fact their brain chemistry is screaming for more and more and
Right.
more.
So what would you do in a circumstance
So
like that?
in a circumstance like that, we I encourage them to keep a food journal. No blame, no shame, no judgment, no criticism. Write down everything that they're eating, and let's see if we can identify if there are particular foods that they're having, they're eating in a particular large quantity, and you know, the recovery from food addiction is to eliminate the foods that we are allergic to,
Right.
that cause problems with our brain chemistry and set up the obsession and the physical craving.
Yeah, to set up that whole obsessional piece.
And attempt to
well, what kind of foods are we talking about? Can you give an idea of a list of foods that are common in your experience?
things made from refined sugar, flour, grain products, particularly wheat, flour products, high fat,
Like bread,
like bread,
bagels.
like
Cereal.
bakery, all of the stuff that many people can't imagine living without. And when in fact, if a person is a food addict, that which they think they can't live without is really what they need to learn to live without, one day at a time.
Now you're actually saying that they can't eat these foods.
That's right, because it sets up the physiological craving and the yearning to want more and more and more.
So I just want to clarify this. You're actually saying they can no longer eat bread,
That's right.
and sugar,
That's
and
right.
cereal,
That's
and processed foods.
That's right.
What can they eat?
Right. They can eat.
I mean, that's a pretty
It's
drastic.
Recovery from food addiction is not for everyone. And it's worth it for those who whose lifestyle has deteriorated to the point where they feel hopeless and helpless. So it is about eating non-starchy vegetables. A variety of color of non-starchy vegetables. The greens, the yellows, the oranges, the reds.
Right.
It's about eating,
but not the whites. Not the whites.
But not the whites.
We have a caller, and I want to get back
great.
to that. But let's get Sue on the line.
Okay.
Sue, welcome to the show. Why don't you give us your question?
Thank you. Can you hear me?
Yes, we can.
Great. My question is for Dr. Tarman. It's just about if you could tell us a bit about the inpatient treatment program that you're piloting for food addicts.
Yes, I'm happy to do so. Food addiction as a diagnosis is not acknowledged yet by the medical profession or the healthcare profession, and that's the reason why it's very difficult to get treatment. We've been blessed by a private donor who heard about the campaign about food addiction and said that she wanted to support some venture in food addiction. And so Renaissance has agreed to add to the program that they already, because it's an addictions treatment center residential program, they've agreed to expand their program to include food addiction. So it's a 3-week residential program that actually Martha has been asked to join us with, because Martha, you do really the outpatient care work. This is a residential program, so it's essentially going to be a 3-week detox, because we're going to offer what we call an abstinent food plan, which I'm hoping that's kind of where we were going with our conversation.
Yes.
And also some counseling, which Martha will be part of, to kind of get the person started, and then they have to do some sort of follow-up afterwards, either through peer support in the community or through people like Martha. We're very excited about this. Thanks for asking. And how did you find out about it? Just from what I just said now, or?
Well, I just want to say hi to Martha. I found out about it through Martha.
All right.
Martha, it's Yolita and I. We're both here listening to you.
Excellent.
And I'm very excited to say, Dr. Tarman, that I'll break my anonymity here and say that I'm coming into the program.
Oh my gosh.
Yeah.
And I am Martha spoke about hopeless and helpless.
Oh.
That is me.
Yeah.
So I really believe and hope that this is going to save my life.
That's great. And you know what, Sue? After you've gone through the program, please call on another Monday night when this show is on and let us know how you did, because this is great news. I'm so pleased that this donor has come forward. And like Martha said, you're very courageous to call here and also to come to the program. And it's scary giving up what is it? Pasta, sugar, flour, bread, bagels.
Right.
Anyway, thank you, Sue.
Thanks, Sue.
So, Martha, what would the food plan look like that you would design?
So the food plan, and what is recommended that a recovering food addict eat? There doesn't seem to be one plan that's engraved in stone that's perfectly right for everyone. What they all seem to include is lean protein eaten, at least 3 times a day, and a moderate amount of about 4 ounces. And that protein may come from critters, from poultry, from beef, from fish. It may come from vegetarian sources, tofu,
soy,
nuts, beans, and that sort of thing. Wheat germ. Yes. Lots of vegetables, non-starchy vegetables.
Right, all the colors that you were saying.
Right, and perhaps some starchy vegetables like yams and squash. There are some food plans that include whole grains other than wheat.
And these things are all not addictive.
Well, and again, it depends upon the individual. That's why it's so important to have support while a person is, because they may be given a food plan from a professional or from a support group, and they may need to fine-tune their food plan within the food plan.
Right. And one thing I want to point out is that if you go to, for the viewers especially, if you go to a dietitian in a hospital or a nutritionist in a hospital, they will most likely not promote a food addiction plan, because they'll be including the grains and the cereals and the whatnots.
Right. They will expect you to be able to eat all foods in moderation.
Exactly.
And asking a food addict to eat, a slice of whole grain bread can set up the physiological craving.
Right, just like the alcoholic, just having a little bit of a drink will make them want to drink more.
That's right.
Yeah, and it's not necessarily that they'll want to drink more after that first sip, but after a glass or two, and it can be a slippery slope.
That's right.
Yeah. Now, one of the things that I talk about it a lot in the book is we have stages of food addiction, and so that a person might be able to get away with just not eating sugar or flour initially, but then if the disease progresses, that at some point they can't have a whole lot of other things that somebody else could eat.
That's right.
And so it does have to be really tapered down, narrowed down.
That's right.
And how would you work with that?
Well, again, I encourage folks to keep a food journal, and even after we've established a food addiction, a recovery from food addiction food plan. Again, continuing to track how the person is feeling as they're eating the foods, how they're feeling after they've eaten the foods that are under the heading of a recovery from food addiction food plan, because they may, for example,
we have a caller.
Great.
Okay, so we'll come back to that. Ben, welcome to the show. Why don't you give us your question? Ben? Hi, Ben.
Hi.
We got you there. Welcome to the show, and what's your question, please?
I was just wondering the benefits of fasting. Or the effects of fasting, and how much protein should I get from animal sources in my daily, like how much should I get from animal protein?
Are you speaking as a potential food addict, or just as a general nutritional question? Because that could be a separate thing.
Oh, just when it comes to, I used to have those problems, but what I realized was to just more add food to my diet than just focus on taking food away from my diet. So adding more vegetables, and then not necessarily focusing on reducing the pasta, but then that naturally happens over time.
Okay.
By just adding stuff, and then later so.
Okay, and then that works for you you're able to do that.
Yeah, I feel like that works, and we're just restricting.
Okay. So I mean, that sounds like you're asking a legitimate question, but it wouldn't be a question from the point of view of a food addiction, because you wouldn't be able to stop like that. But you asked the question about fasting, and are you, well, what's your opinion about fasting, Martha?
Well, my experience for someone that is a food addict, I don't recommend it, because it can set the person up to want to binge. If a person needs to refrain from eating for medical reasons because they're having blood work done and they have to have a fasting blood sugar or whatever, I think it's as important to eat a healthy meal as soon after the testing as possible.
Although there's also like religious reasons too. And Ben, I don't know if you're if one of your thoughts is there's a whole kind of, I don't know if it's a thing people are talking about called intermittent fasting, and the idea of only eating in the evening or missing a whole day every second day. Is that the kind of thing that you're asking about, Ben?
I'm familiar with that concept, but not necessarily to that extreme. But it's just sometimes, like in the morning, not to eat for like a few hours, or if your day is can like you can afford to do that if you have to go to work early in the morning. I understand that, but maybe just like a few hours on a Saturday, just to like reformat
Yeah, there is some thinking that there's a legitimate reason or a medical reason for doing that. It's not something that we would recommend because with anybody who's got either even an eating disorder, because it sets up the deprivation syndrome, and as you say, it sets up the binge starve cycle. And we're usually working with people who are already so entrenched in that we're trying to get people out of that. So I don't know if I can comment on the health value of that outside of food addiction, but we certainly wouldn't recommend it within the context of food addiction. Ben, just let me ask you quickly, when you do fast, don't you have the desire to eat a lot when you're starting to eat again?
Not necessarily. Not necessarily. I feel like when I kind of lose my appetite, like over the first few days, it's really difficult. But over a long period of time, my appetite doesn't necessarily, it doesn't really bother me like it did before.
Okay. Well, thanks, Ben. I understand that. You're talking about a heavy-duty fast, like a 7-day fast or a 3-day fast.
Oh, no. Just like what I'll do is maybe like 12 hours of the day I will not eat. So like
got it. Okay.
So I sleep for 8 hours.
Yeah.
And then I go to sleep.
Thanks, Ben. I think that probably from the food addiction point of view, we wouldn't push for that. We have another caller, Mildred. Mildred, can you hear me? Mildred, welcome to the show.
Thank you.
Welcome to the show, Mildred. Can you hear us?
Yes, thank you.
Excellent. What's your question, please?
The question is how I can participate in the program for the addition to the food.
For the which program? The Renaissance program that I was talking about earlier?
Yes.
You can call the Renaissance number. I actually don't have it in my head right now, but you can find it easily online, and just ask to speak to there's an access center. There's like the person who answers the phone will give you more information about that. So just call them because we're actually taking referrals right now.
Okay. How I can find the number, the phone number?
Is it on your website?
We will give it to you. It's on the website, but we'll actually give it to you. But are you thinking that you might have a problem with food addiction, Mildred?
Yes, very much.
Yeah. Do you want to say something about that, or?
Not really.
No, that's fine. That's fine. Thank you.
Thank you so much for your call, Mildred.
Yeah.
You're very brave to call.
Yeah.
Please call Renaissance Access Center.
Yes, and then you'll both of us there.
Yeah.
Okay, so Martha, I want to get back to this diet. Is it a diet?
It's the way I describe it to folks is that it's a plan of eating that we can live with one day at a time.
Yeah. Can you eventually go back to eating the pasta and the bread and the whatevers?
If a person is really a food addict, no. Because actually what I see is the cleaner a person gets with their food, the more, actually oftentimes the more sensitive they are to consuming, or there's a more of a reaction, less affects them more if they do get an addictive substance into their body. So
it really gets worse.
That's right.
Yeah.
Wow. Less affects them more, so it takes less sugar in order to set them up to crave and want to binge.
So when it's Christmas time or Halloween, what are they going to do?
We find other ways to celebrate the Christmas season. We find other ways to celebrate Halloween.
So like no more Christmas cake.
That's
right.
More there's
Halloween candy.
So just like the previous caller, I encourage them to find healthier ways or different ways to self-soothe and to take care of themselves other than using food for that purpose. It's about finding other ways to celebrate the Christmas season or to celebrate Halloween that actually do not use your creativity and find other ways to celebrate.
What if it's your birthday and somebody makes you a birthday cake?
Right.
What if it's your wedding and you've got a wedding cake?
Right.
Are you going to say no?
That's right.
Really?
You say no. Because pleasing this other person because they made a food item for you that you're allergic to.
You can't have even just a little piece.
No.
Why not?
No, because it sets up the physical craving, and then the cycle of wanting to binge starts all over again.
Okay. All right. That's it. That's what it is, eh?
Yeah. Again, just like alcoholism. If a person is in recovery from alcoholism and they pick up a drink, even a small drink, it can send them out on a bender, right? And when are they going to stop? And where are they going to go with their health if they don't stop?
Yeah.
And are they going to be able to stop?
Yeah. If there's any callers out there who are, wanting to give us a call, please do. This is This is a time to ask these questions. Martha is an experienced food addict therapist. Please give us a call. We're happy to take your questions. All right. So, what if you have a slip, Martha? What if it's hard to not eat this stuff.
That's right.
You're at a Starbucks corner, and there it is calling to you.
That's right, and it's it's so important to find other recovering food addicts and get as much peer support as possible. And what I say to clients is, I don't know too many food addicts that have perfect back-to-back abstinence because it's even unintentionally. You might go into a restaurant setting and ask the waiter or the waitress, what is in, for example, the salad dressing, and they assure you there's no sugar in it, and maybe there is, and it sets up a physical craving, and there's a slip.
Right.
And if we,
like the person goes home and now they're suddenly obsessing about their
that's right,
old
and they're
food.
white. That's right.
Yeah.
And the disease is one of isolation. So recovery is about breaking that isolation and having peer support. So hopefully, if a person is craving or has had a slip, they will break isolation and reach out for support from their support system.
Yeah, I mean, I'm asking you a lot of these questions because these are the questions that people ask me.
That's right.
And so one of the things that they'll say often is, well, I've had a slip. I may as well just go all out because I've been holding back all this time. I may as well just go all out, get it out of my system, and then I'll be fine. Because really, I've just been depriving myself. If I just have a little bit, I'll be okay.
And so it really is changing one's attitude about their relationship with food. Food is fuel. Food is fuel. We fuel our body at regularly scheduled intervals, 3, 4, 5 times a day, depending upon the food plan a person is on.
But food is also a social
It is a
behavior.
social thing.
It's more than just fuel.
And it is, and so it's about using one's fuel in social situations because we're allergic. And so we're on a special...
Are you saying you can never enjoy food again?
I'm saying you can enjoy food within the boundaries of your food plan. So when as a recovering food addict myself, if I'm hungry for beef and I want to have a steak, I make sure that I enjoy that steak.
So you still enjoy your food?
So I still enjoy my food, absolutely, within the boundaries of my food plan.
And you still hang out with people and have dinners with people?
Absolutely, I do. And the people that are, I've been in recovery long enough that the people in my life understand that I have food allergies, certain things I cannot eat, and we can still go out to eat, and I order what's right for me, and they
still go to a restaurant.
And they order what's right for them.
Okay, do you mind talking a little bit about your experience?
Okay.
Okay. So you're a declared food addict.
Yes.
And so how did you know that you were, and what did that look like?
Well, when I hit bottom with my food addiction, there was nothing out there about food addiction. You hadn't written your book. Kay Shepard had not written her books on food addiction, and I reached out for peer support, and someone I reached out to said that she thought I had a problem with sugar, and she asked me. It was quite an intervention, and she asked me if I couldn't let go of sugar for myself, could I try just not eating refined sugar for 2 weeks and see how I felt.
Okay, and how did that go?
And how that went was I went through well, what I told her was I had the worst case of the flu I'd ever imagined, and really I was in detox
You're
and
in
withdrawal.
detox. You know what? I'd like you to talk a little bit about the detox. I want to get back to your story, but can you talk a little bit about the detox?
Detox.
Because people are afraid, intuitively knowing it's not going to be easy to
Right,
quit.
and that's
sugar,
why the
flour,
program.
bagels.
That's why the program at Renaissance is so great, because it's a 3-week time period of being in a safe place and being on a safe food plan.
And it takes about 3 weeks, doesn't it?
Yes.
Yeah.
I don't think 2 weeks is long enough. I think it takes 3. The symptoms can include headache, body ache, sweats, lack of mental clarity, physical coordination issues, disturbed sleep pattern, either wanting to sleep all the time or having difficulty sleeping, gastrointestinal discomfort, diarrhea, constipation.
Yeah, and I would imagine massive cravings for sugar.
Absolutely. Shakes.
Yeah.
Yes.
Yeah. So how does a person manage to get through that? I mean, you know, Renaissance is a new how do you do that on your own?
Well, again, you don't do it on your own. You reach out for peer you reach out for peer support, and we help each other. We help each other. I know some folks who have opened up their home and allowed
actually go and stay at their house.
Actually stayed with someone while they were going through the most acute part of their withdrawal.
It reminds me of, like, you know, I'm an addictions doctor, and we hear about people going through an opiate withdrawal. You know, you just lock them in that room, throw away the key, you know, figuratively, for three weeks. Help them with their food, their whatever, and just help them wait it out.
Right. And basically that's what we do with recovery from food addiction as well.
Yes. So if there's anybody that is interested in the detox piece of that, I mean, and you know, interested in Renaissance, we have the number on the screen there to you know, check it out. Okay, so Martha, the person goes, you went through the detox, and then you survived the detox, obviously.
Right.
And you didn't have a little slip, a little piece of something or other? No.
Of course.
No.
Oh,
you did?
What I say is, if a person has perfect back-to-back abstinence, they're probably not a food addict. Because as hard as we may try to make sure our food is perfectly clean, you know, with the way foods are processed and so on, we may get a little something, or we may think that we can take control and have just a little bit of something, and have a slip, whether it's intentional or unintentional.
What about if you're a food addict and you're trying to quit you're trying to quit all your foods, and you're going to go for the 2 weeks like you had the challenge put to you? Can you do other things like drink alcohol to help you along? Smoke a joint?
No.
No? Why?
No, because, smoking a joint might set you up for the munchies, and alcohol is the simplest form of sugar there is.
Right.
So if a person if a person is in recovery from food addiction and they are vulnerable to other addictions that are substance related, they really need to be in recovery from those as well.
Yeah, exactly. So you really, a bona fide food addict who really wants to do the recovery program can't drink either.
That's right.
Wow. I mean, that's a pretty drastic statement. Yeah. Okay.
Or smoke a joint.
Or smoke a joint, or do any other drug at all.
That's right.
Yeah. Okay. Wow. That's heavy duty.
It is.
Yeah.
And the people that make the commitment to recovery from food addiction are people that are in a pretty feel pretty hopeless and helpless,
But what are you offering them? Now, I'm playing the devil's advocate. Here you got a person who's not eating sugar. Now they can't drink alcohol either. They can't have their whatever it is. Their marijuana, whatever. What are you offering them as an alternative? Okay, so maybe some tasty vegetables, but what kind of life is that?
What kind of life is that? That's a life that is free of obsession
Okay.
from binge foods, improved physical health, improved mental health, a life that includes community rather than isolation.
Okay, are they happy or are they just going, oh, I want that cake?
Well, if they really hit bottom with their food addiction, I'm an example of that. I was.
We just got a little bit more time. Keep going.
The quality. Though I'm a senior now, my quality of life is still much better than it was in my late 20s.
Like, would you say you're happier than when you could have your? Yeah.
Absolutely.
Yeah.
Absolutely.
Okay.
Lots of, as the disease progresses, there's depression, there's hopelessness, there's not much life there.
Yes, okay. I mean, and instead you're feeling empowered, your weight is under control.
Yes,
Yeah. Yes, okay, all right. So, I mean, it's a liberating lifestyle.
Absolutely.
Yes, okay.
Absolutely.
Okay. We'll be right back after the break with more help on Toronto Speaks Addiction. Welcome back to Toronto Speaks Addiction. Today we're discussing and taking your questions on food addiction. Callers, if you'd like to give us a call, please do. So Martha, now that you've done the detox and you've actually done the work of stopping this food, and we're talking about that you actually feel really good afterwards in terms of liberation,
Right.
but there must be some kind of emotions because if people are using food for comfort,
Right. Right.
I mean, what's underneath all of that?
Right. Well, and what's underneath all of that is lots of suppressed feeling, especially
Okay.
if we're not smoking joints and we're not drinking and we're not drugging.
So what are you going to do?
So we learned how to establish a relationship with our feelings and learn how to identify them and feel them and manage them in a healthy way, so that we don't have to.
And this is something probably that's going to be new because they've been using food.
Right. For me, I started binging. My earliest recollection of a binge was when I was preschool age, and so I, had a lifetime of not knowing how to identify and process a feeling that I had the opportunity to deal with in recovery.
Right. Now, when we talk about eating disorders, bulimia, binge eating disorder, we often associate that with a person with a history that like traumatic, some kind of traumatic history, even sexual abuse or something like that. Do you see the same kind of thing with food addiction?
Yes, I do. I mean, and not every food addict has a trauma history, right?
And it's physiological.
But it's physiological disease. However, there are some people that coped with traumatic memories and traumatic feelings by binging, and then found out that they were also a food addict, and so the food addiction took over. So the binge food is taken away, and the traumatic memories and feelings are there. And I do a type of psychotherapy for people with complex PTSD to help them process those emotions. And certainly, first things first is to physiologically get clean.
Yeah. So you can't say to somebody, here's a question that I get asked all the time, should I work with my therapy issues and then my food will get better or my drug use will get better?
That's a really good question, and sometimes I have seen actually where a person is not able to, they're in so much pain, they're not able to do their psychotherapy perfectly clean with their food because it can be so challenging. We've just talked about how challenging it is to do detox. The preferred way to cope is to get physically clean first. And I have to be honest, there are some people that have done, to the best of their ability, some psychotherapy in spite of the fact they're not as clean as they might be with their
Right.
food.
Right. So you would still do that, but you would continually
I
urge
would
that they would get,
yes.
because their cravings are going to continue.
Absolutely.
Yeah. I mean, my experience when people do that is the detox is just prolonged. It just goes on and on and on because they're
Right.
constantly putting food back in,
Right.
which spurs the craving.
Right.
Yeah.
Right. And again, the ideal is to get physically clean first,
Yeah.
and sometimes that just doesn't happen.
Now, one of the things that's my experience, and maybe you can comment on this too, is that people who that are trying to quit food say that it's actually harder to quit the food than it was to quit the alcohol, the cocaine, even the cigarettes.
That's right.
It's harder to quit.
That's right.
Would you say that that's
Yes.
the same too?
I've had folks in my practice who had a magnificent sobriety, clean time from alcoholism, and cry and
Yeah.
say it's so much harder to get clean with the food. As
Yeah.
Judy Hollis,
Yeah.
the pioneer that I mentioned before, always used to say, you got to take the tiger out of the cage and walk it around the block.
We have a caller, so let's take the call. Jackie, can you hear me?
Yes.
Great. Welcome to the show. I want you to give us your question.
Okay. I'm really enjoying your show. I'm learning a lot. I have a serious addiction to chocolate. And I don't overeat. I don't eat pies and bitties and stuff, but I can't stop eating chocolate.
Okay. Do you have a question specifically, or you just want Martha to talk about that?
I understand that there's certain foods that heighten my sensitivity to chocolate.
Right. I see. Okay. Okay. Do you want to comment on that, Martha?
Well, I am smiling because chocolate can be very addictive.
It is actually number one in the addictive list.
Right, it's very addictive and very seductive, and
do you know why? Sugar, fat, salt.
Yes,
It's all of them.
yes.
Yes.
It's the hat trick in terms of addictive substances.
That's right. That's
Yes.
right. Yeah. And so, in a sense, Jackie, you're addicted to literally what has been designated as the most addictive of all of the processed foods.
Right.
Is chocolate.
Right.
Because it's got
Right.
that magic trio.
So does Jackie, does the chocolate, consuming the chocolate encourage you to want to overeat on other substances, or it's just chocolate?
Martha, what happens is I get hungry and I go for the chocolate. Like I was clean for about 4 days and I bought a box of Black Magic, and on my first 2 chocolates I broke a tooth.
Okay. So Martha, what would you suggest that Jackie do with her chocolate addiction? What would be some advice that you'd give her?
Well, of course, the first thing I would suggest is that that she reach out for peer support and see if what happens when she abstains from chocolate.
I mean, you'd ask her to stop eating the chocolate,
Right.
but not on her own.
No,
Yeah.
I would ask, you, Jackie, if this is a behavior that you are not comfortable with anymore, then reach out for support and see what happens when you abstain.
Martha, we just got a few seconds left. Do you want to say some last words both to Jackie and to the audience about food addiction?
Well, it's an insidious disease, and it sounds like it's really hard work
Sure is.
to recover. And it's not black and white. It's not about finding the perfect food plan and never having to worry ever again. It's continue to break isolation and reach out for help.
Thank you, Martha, for your advice. I really appreciate your wisdom. Unfortunately, we are out of time. I'd like to thank you, Martha Peirce, and I'd like to thank all the callers who called in. We'll be back next month with more Toronto Speaks Addiction. Thanks all of you for watching.